There's a mounting body of evidence on how having or being denied an abortion affects pregnant people, including impacts on their mental health and the finances of them and their children. The effects on their male partners have received less attention. In the wake of the Supreme Court overturning Roe v. Wade, experts say that no longer should be the case. It's really naive to think that the repeal of Roe is only going to impact women and pregnant people, said Dr. Bethany Everett, a professor of sociology at the University of Utah. While the issue disproportionately impacts people who can get pregnant, Dr. Everett says it's important to look at abortion access from all sides, as limits on abortion access likely will have broader implications for society as a whole. Research on the impact of abortions on male partners has been limited, but that doesn't mean the issue isn't relevant to men. Using existing data from the National Survey of Family Growth, a recent study estimates that 1 in 5 men have impregnated someone who's had an abortion. That's likely an undercount, according to Dr. Nguyen, a professor of obstetrics and gynecology at the University of Southern California, who helped oversee the project. Not all men are aware of the pregnancies they cause and those that end in abortion, said Dr. Nguyen. For some men who may see abortion as a failure on their part to be a better partner or potential father, or for those whose social and cultural backgrounds have made them feel as if abortion is wrong, disclosing an abortion can be challenging or uncomfortable. In a separate survey of more than 200 male partners of women seeking procedures at abortion clinics, Dr. Nguyen and his team found that about half of them already had children, and supported termination of a pregnancy in order to better provide for their existing family. In her study published in the Journal of Adolescent Health, Dr. Everett and her team found that young men who were involved with a pregnancy and whose partners had an abortion were nearly 4 times more likely to graduate from college than those whose partners gave birth. Her research also suggests that males under the age of 20 who were affected by an abortion were likely to earn more money than those who became parents but did not live with their child. Earnings between those who became parents and lived with their child and those whose partners terminated a pregnancy were about the same, Everett said, possibly because those who became teen fathers entered the workforce sooner. But still, you likely would see later down the road economic capital B. Those differences are significant but not surprising. According to Dr. Everett, previous research generally has linked delayed parenthood with greater educational achievement and future socioeconomic status for both men and women.